Welcome to Primary Children's Hospital and the Division of Pediatric Neurosurgery. My name's Bollo. I'm the director of the Nathan Avery Memorial Fellowship in Pediatric Neurosurgery. I'm one of 4 pediatric neurosurgeons on faculty at the University of Utah, practicing at Primary Children's Hospital. I'm here today with Melanie PAYNE, who's the coordinator of the fellowship program. And we're going to give you a virtual tour of the hospital and a sense of what life is like here at Primary Children's Hospital during your fellowship year. Primary Children's Hospital is a regional children's hospital and the only children's hospital in the Intermountain West. We're a level 1 trauma center and we do between 800 and 1,000 cases a year. Primary Children's Hospital is part of Intermountain Healthcare. However, we're faculty at the University of Utah, so we have the benefits of working at an extremely efficient hospital doing high volume pediatric neurosurgery on a wide variety of surgical cases with all of the resources of a strong academic neurosurgery department. During this video, we're going to tour key parts of the hospital and meet the remainder of the faculty and key staff.
Hi, my name is Melanie PAYNE and I am the fellowship coordinator. I work very closely with Dr. Bollo on a daily basis, as well as our fellow and residents. I'm always here to help. No matter what you need, I can always find a way to make it happen.
We look forward to welcoming you to our hospital and our facility and giving you a taste of what life is like here in Utah.
Hi, I'm John KESTLE, pediatric neurosurgeon, and thanks for checking out our fellowship. I think it would be a fantastic experience. One thing that I think is really important is to spend time talking to the fellows that have been here, so you can understand what their experience was like and understand how they felt when they left the fellowship as far as being able to start practice. We've had a pretty even number of fellows going into a very academic setting and some going into more of a private setting. And because they've had a good operative experience, I think they're well prepared for either of those. There aren't a lot of big egos here. The attendings are all from different places. So you'll see slightly different approaches to the same problem, which is an advantage. Then you can make up your mind about which of those things you like. But talk to the fellows and you'll get a really good sense of what it's like to be here and what it's like to live here. And call if you have questions. I'd be happy to talk with anyone about it.
My name is Dr. Samuel CHESHIER. I am the newest member of the faculty here at the Pediatric Neurosurgery Division. And since I've been here, I have just been very pleased, both clinically and operatively, about the opportunities. And in terms of patient care, the breadth of brain tumors that we see here and operate on here is just amazing. Definitely the most incredible cases I've ever seen in my lifetime. I would like to say that the hospital, the Primary Children's Hospital, is the easiest hospital I have ever worked in. We ask for a scan, we get a scan. We ask for a consult, we get a consult. We ask for OR time, we get the OR time. We will have a lot of fun together in the OR, discussing brain tumors, discussing all things pediatric neurosurgery. I definitely look forward to meeting you now on Zoom, but maybe in person at a meeting in the future, and maybe here if you choose to become our fellow. Thank you.
Hi, my name is Doug BROCKMEYER, and I'm Division Chief of Pediatric Neurosurgery at Primary Children's Hospital. We appreciate the interest you have in our Pediatric Neurosurgery Fellowship, and we look forward to meeting you in person or at least virtually in the next few months. We have a long history of training Pediatric Neurosurgery Fellows at Primary Children's with 28 fellows that we've trained at last count. If you come here, you'll be exposed to world-class facilities and world-class mentorship. My partners, John KESTLE, Sam CHESHIER, and Bollo, are deeply immersed in their areas of subspecialty interest, and we hope that you can be exposed to them and their expertise. In summary, we are kind of a laid-back group. We enjoy having fun, we work hard, and we play hard, but at the same time, we're very dedicated toward fellow education, and we hope to give you the best that we can offer. So we'll see you soon. Thanks.
I'm Sherry Loy. I am the clinical care specialist for pediatric neurosurgery. I am here to help navigate through clinics in the outpatient side.
Sherry is one of the most essential people in our office, and she helps make sure all of our patients get the clinic appointments, scans, and surgeries. And she helps talk to the families on the phone and keep them happy and reduce anxiety for families and parents dealing with critical, difficult situations.
Hello, I'm Sydney. I'm the nurse practitioner for the neurosurgeons, and I've been working at Primary Children's Hospital since '97 and with the neurosurgeons since 2004. I think we work really well together. I think they're the greatest men on the earth and the greatest neurosurgeons in the nation. We work hard, we're busy, but we work well together as a team, and so I think you would enjoy it here.
Hi everybody, my name's Raj IYER. I'm the current Pediatric Neurosurgery Fellow here at Primary Children's Hospital in Salt Lake City for 2019 to 2020. I just wanted to let you know about my experience really briefly. It's been an incredible year. I've learned so much, and I've had a wonderful experience working with all of the attendings and the staff here in Salt Lake. I've learned a lot. I've done a lot of complex cases, and it's just been a wonderful experience. The mentorship is unparalleled, and my wife and I have really enjoyed spending time in Salt Lake City and visiting national parks in the area as well. So if there's any questions, I'm happy to answer them about the fellowship. It's been a great experience, and please feel free to reach out by getting my contact information from Melanie. Thanks so much.
So now we're going to take you on a tour of the hospital and show you the ICU, the OR, the neurotrauma unit, and some other critical places here at Primary Children's where we work. Come on. This is one of 2 Ronald McDonald family rooms here at the hospital. Everything at Primary Children's Hospital is about the kids and the families and making sure their experience here is as much like home as it could possibly be during these critical times. So this is the front desk of our main OR, and we're going to show you the neuro operating room, as well as meet some of our neuro team nurses today. Ready? Okay, let's go. Welcome to room 5, our main neuro operating room. This is where about 80% of our cases get done. Because this is such an efficient hospital with such efficient turnover, the fellow benefits because we can do most of our cases in this room. Each attending has a specific day that they operate and have block time. So as a fellow here, you don't have to choose between the craniocervical fusion and the hemispherectomy and the brain tumor. You can do all of them.
Hi, I'm Jordan. I'm a surgical technologist on the neuro team. I love fellows because they bring a new perspective and they're really fun to work with.
Hi, my name is Melissa. I'm the neurosurgery team leader. I love fellows because we get to work with them closely and we help them get all the supplies that the surgeons want, and this team is awesome, so come to primaries.
From my perspective as a surgical technologist, what I really love most from meeting our new fellows is, again, learning their techniques and perspective on things. What's really appreciated is their willingness to learn what we have to share with them. They're not only here to expand on their skills, but I feel like they should be willing to learn each of our surgeons. They all bring something a little bit different to the procedures and to the operating room that they can all take a piece of and learn from and take with them.
From here, we're just going to walk across the hall to the pediatric ICU on our way to the neurotrauma unit. This is our pediatric ICU. It's a very large ICU where we do coordinated care together with the pediatric critical care team. We work closely with them on neurotrauma and managing our perioperative patients. They're wonderful to work with, and in general, we have an excellent relationship. It's a big open unit and our patients get excellent care here. We're leaving the ICU now on our way to the neurotrauma unit, which is our step-down unit. That's where most of our neurosurgical patients spend the vast amount of time while they're in the hospital. They can have EVDs on that step-down unit. We have neuroscience nursing and a neuroscience nursing liaison. It's for neurosurgery, neurology, rehab, and orthopedic patients primarily. We also have our physical EMU located there. So the NTU is organized into pods. There's pod E and D to my right, and then the remainder of pods are over to the left. The rehab gym is currently to the left, and there's currently an addition being built which will be completed during the next fellowship year.
Here on the NTU, our nurses specialize in many neurological diagnoses and neurosurgery procedures. We specialize in neurosurgery assessments. We work very closely with all of the neurosurgery teams, their nurse practitioner, their residents, their fellow, and their attendees.
From a management perspective, we get to work closely with the neurosurgeons, residents, and fellows, and we get to come up with ways to make care better for patients and really dig into what's important for our caregivers to do for our patients.
Here at Primary Children's, safety is a very important part of our culture, and everybody is empowered to speak up and improve patient care and the lives of children, and that's something we take to heart. Now we're headed out of the main hospital over to the outpatient building across the bridge. Welcome to the outpatient building at Primary Children's Hospital. From a neurosurgery standpoint, this is where we have our multidisciplinary spina bifida clinic 3 Friday mornings a month. And every Wednesday afternoon, we do the multidisciplinary fetal clinic here, where we evaluate patients with congenital anomalies together with the remainder of the multidisciplinary team. On Wednesday mornings, we have multidisciplinary epilepsy surgery clinic here as well. All right, well, thank you so much for taking our virtual tour, learning a little bit about our fellowship program here in Utah. We look forward to meeting you during our interview process, getting to know you a little bit better, and hopefully seeing you here in Utah with us in the near future. Please call with any questions that come up whatsoever. Thanks again.